Your insurance plan may consider an in-network provider to be a requirement, an incentive, a choice, a financial benefit. So let's go over the basics today and how best to use this option. Welcome. I am the Medical Bill Whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. So, what is this network? Well, it is a list, a compilation of medical providers that have contracted with your insurance plan. They could be individuals, professionals, working in their own office or within a medical group, PCPs or specialists, therapists, whether occupational, physical, speech, or mental health, home health agencies, nurse practitioners, physician assistants. All those professionals could just be working out of a hospital or facility, for example, ER doctors, anesthesiologists, pathologists, hospitalists, radiologists, medical directors. But a provider can also be a facility, meaning an actual place, location, where services are rendered and where patients can use the equipment, the staff, the supplies, the drugs, a bed, machines, for a time period that can range from an hour or so to several or more days. For example, emergency rooms, hospitals, surgery centers, urgent care locations, infusion or imaging centers, pharmacies, ambulance, skilled nursing facilities, residential or mental health treatment facilities. How it works is pretty simple. A provider signs a contract with your insurance plan. They are now considered in-network and get onto that in-network list. That means the provider accepts a reduced set fee for each service, item, supply, procedure, drug that they provide to members of that insurance plan. In return, they get some benefits: faster payments, direct payments, less administrative hassles, preferred funneling of new patients, financial security, no need for prior authorizations, or easier to get if necessary. Once services have been rendered, the provider submits a claim form to your plan, which contains coded data detailing what was performed and or provided. The insurance system uses those codes to calculate an allowance for each service or charge, and based on the terms of the contract. Payment is then issued to the provider, except for any portion of that allowance that is applied towards the member's share of cost, deductible, copays, co-insurance. The difference between the amount billed by the provider and the allowance set in the contracted rate with the insurance is a write-off. It is called sometimes an adjustment, and to you, it means a discount. But do consider that an allowance only can be applied towards your yearly share of costs and not the full amount billed. So what does it mean for you? What advantages do patients get? Well, first, easier, faster access to care. You get privileged treatment at an office or hospital. You do not need to get involved with claim submissions, claim processing, or even appeals. Preferential payment terms for any liability is usually extended, and the easier authorization process works on your behalf. Clinically, those in-network providers are supposed to be fully vetted by your insurance company. They will offer free preventive services to all members of your family. And the list of in-network providers can be extensive locally within the state of your residence or even around the whole country. The financial advantages are great. You get a discount on all services, procedures, supplies, etc., provided or performed by an in-network facility. This is the lowest overall share of cost and liability you can get, and the highest payment by your insurance that can be done. So overall, using in-network providers is definitely the best use of your policy, brings you the most advantageous benefits, and is the very best way for you to save money. Let's see some tips, especially as some out-of-network providers can be considered in-network, paid more by your insurance company under certain circumstances. The first one would be for emergency services, from the ambulance to the ER to potentially an inpatient stay, for example, for an emergency surgery, care rendered as part of or directly in response of an ER admit should be considered by your insurance at the in-network rate. That is federal law. But you may also have indirect hires when you visit an in-network hospital or facility. This could be the hospitalist, radiologist, the anesthesiologist, or even the assistant surgeon. In such cases, most policies will extend an in-network rate to such providers, as you have no choice of an in-network provider and certainly no opportunity of hiring one even if you could locate one. Mention federal law. Yes, there are state and federal laws that force an insurance company to pay in-network rate for out-of-network providers and not only in case of emergencies. For example, if no in-network provider is competent, available, trained, experienced in the type of care that you require and you must therefore go out of network, this could qualify for an exception. Another reason would be if an in-network provider is not available at this time or within a legal access to care mandate. If they don't take on new patients, for example, in such case, you might be forced to go out of network and your insurance could well be forced to pay the higher rate. And if an insurance must pay in-network rates to an out-of-network provider, that means you pay less. Of course, I will advise you to please make sure that your provider is in-network whenever possible. To find one, go online. Your portal has a tab, Find a Provider, you can use to find a specialist, a PCP, a hospital, or any other medical provider. You can also call your insurance directly to request a list be sent to you. And I would also confirm with a provider that their status is in-network at the time the services are expected to be rendered. And that brings us to document. Take a screenshot or print the entry on the online insurance list and date it. Why? Because network lists are updated on a monthly basis at best. And keeping such a record from a provider's website, especially a hospital, could be helpful too. Contracts can be cancelled. If you are misled to consult an out-of-network provider at a much higher cost, well, showing such evidence can force your insurance to indemnify you for the extra dollars you were forced to pay unknowingly. Another thing to remember, network sizes vary according to the type of plan you have and terms of policy. However, insurance lists of in-network providers must always be made available to members. So it is well worth using in-network providers whenever possible and appropriate. I so thank you for watching. Your likes, subscribes, and comments help support this little growing channel to reach out to more patients like you. So thank you.